I've got Ben and Marion with me, who are directors, founders of the King's Village in northern Ghana. Many of you know them already, but they, over the last 20 years, have pioneered a church and supported village churches. They've built a hospital, they're building a maternity unit, there's 200 staff overall working for them. They've got 2 schools going, a child assessment centre, mental health facility, just doing an astonishing work. And so I'm just interviewing them for a moment. So Ben, talk to us about particularly the health side over the last 6 months. We're aware that Ghana has got away more successfully than, say, the West in the context of COVID, but how has this season impacted you?
Yes, the COVID came to change a lot of things. Our main objective when we heard about the outbreak was how to protect our staff and also to protect all the people in King's Village as well as ourselves. And so we put in place various protocols, and one of that was everybody who was entering the hospital, we have to check their temperature, we have to make sure that they have washed their hands, that they have masks on. This is continuing up to today. We also made sure that the staff had all the protective equipment that they need. And basically, it was an enhancement of the protocols that were existing in the hospital and making sure that they have all the materials they need. And this helped to actually stay off the outbreak of the COVID among our staff. We heard that there was an outbreak at the teaching hospital. And so we were very proud that what we did here, even though it was very basic, was very effective. At the same time, we also instituted some public health outreach where our public health team went to the villages and did some public health education. And also we monitored some of the people or the population that were coming back to the district, especially some young girls and young boys who have gone to the south to carry goods for people. They were very high risk group. So when they came back, we made sure that we went to the villages, registered them, advised their families as to how they should isolate them, and make sure that they don't bring COVID into the district. And so that went on very, very well. We also did some public education on radio, and that was really great. I want to take this opportunity to thank all of you who supported us in raising money to buy PPEs for our staff and make sure that this COVID doesn't come to the district, which has worked so far, and we are very grateful.
No, and I want to add my thanks to everybody who donated as well. Talk to us about the ventilator. That I saw some figures early on in the pandemic, how we've got here in the UK 30,000 ventilators. Ghana's got 200, and in the whole of Africa, I think it's 2,000. So people raised money, and through the Assemblies of God as well, I think about £17,000 came in. So we bought a ventilator and a baby ventilator that has arrived recently. Just talk to us about how that's going there.
Yes, we are very grateful for the support from Assemblies of God and all the churches that gave towards that. The ventilator arrived safely about a month ago, and now we are probably one of the few hospitals in the north that has got a full functioning ventilator. It also serves as an anesthetic machine because it's got an evaporator, which can also be used for surgeries. And they also send us a baby CPAP machine, which will help a lot in the maternity and save a lot of children's lives. We had a training by the Diamedica team, which our team here participated, and they learned a lot. They've also learned how to actually maintain and take care of the machine. So everything is pretty much in place. If there is any outbreak here, or any of us fall sick from COVID, or any of our staff fall sick, at least we have a ventilator to help keep us going.
Wonderful.
Thank you.
No, wonderful. Marion, talk to us about the schools, how you've managed through that season. What's that been like?
Well, it's been difficult, but we've been following the government directive, which said that all schools should close on the 15th of March, and most of them will not be open until next January, which will mean for 10 months, a lot of children haven't been to school at all. So we'll have a lot of catching up to do. The government said that children who have exams, that those classes can come back. So in July, our Form 3 class of the JHS came back and they did their exams in September. Currently, the following class is in school for this term, but all the primary children are still at home. The Ghana Education Service has given out books which we've taken to the different children in their homes, which is reading books and activity books. And also we've started a new initiative, which is a library van, which 3 of our teachers go in, and they've been travelling to 8 different communities from Monday to Friday with about 200 books to teach the children in those communities. Our children all come in their uniforms because they're missing school so much, but other village children also join them, and we're able to do a lot of teaching that way and also check on the health of the children. So we're now preparing for January when everyone will come back. We have to do more social distancing, prepare masks and hand washing stations, but we're on with it, training all the staff, and we're very excited about seeing the children again coming back.
Yeah, and I commend your innovation and connection with the kids that are spread out over these different villages. No, wonderful, well done. And Ben, the maternity unit, obviously you're still operating out of those 2 rooms for 70 births a month or whatever, and we're building the maternity unit. Just explain to people the next phase for that.
Thank you very much. Once again, I want to thank all people who have given towards that. We are set on to go to the next phase, which will involve laying electrical cables, fire alarms, and intranet connections, and also to do the ceiling, the floor, and everything. At the moment, we've got some funds to be able to do the wiring for the whole building, and the next phase will be to focus on one section of the building so that we prepare it and be able to move the midwives in to continue with the work of serving the mothers and the children in the communities.
Yeah, wonderful. And we're just glad things are progressing. Also this year you've opened a child assessment centre, which is rescuing children that are at threat of trafficking, and so that's new. How many children are in that, Marion, at the moment?
We have 14 at the moment, 3 girls and 11 boys, and I've been going in every morning to do morning devotion with them, which is going really well. And we also have 2 teachers who go in Monday to Friday, so 1 for each day. So they're learning the basic skills so that when they go back to their families, they can continue with their education.
Yes. And they join in our services on Sundays as well, so that was great.
Wonderful. And so I'd encourage everybody to check out our Facebook page, Kings Village Ghana. Lots of updates on the nutrition centre as well, and the mental health facility. All that's on there, or our website, tkvg.org.uk. I think what I'd want to encourage anybody listening who wants to support, there's 2 areas we're focusing on right at this time. If you want to sponsor a child, go onto the website, look at the education section, and you can sponsor a child for £15 a month. Or if you want to support the building of the maternity facility that will save lives, then please donate to that, and the money will be incredibly well spent. Ben and Marion, we celebrate you, we congratulate you. In a year's time, we want to bring out another NG trip to come and visit you, and we're really looking forward to that.
Thank you for all of your help, we appreciate it, and we look forward to your next trip.
Thank you very much indeed.
Bye.